Now, Eyewitness News is your vaccine authority, and this evening we are helping you get set up with those shots that you qualify for, and if not right now, you will soon. Channel 3's Aaron Connolly is live for us right now at the United Way, where everybody's standing by to take your questions. Aaron, this is such a great resource for everybody here.
It really is, and this is a tremendous effort, and there are so many people behind this effort. One of them with me right now, this is Tanya Barrett. She is the Senior Vice President of 211 Health and Human Services. Tanya, thank you so much for being with us.
Yeah, thank you for having us.
So tell me a little bit, we keep showing the number obviously because we want people to know about it. This just started January 14th. How did this assistance hotline come into motion?
Yeah, it came up pretty quick because state government really wanted to make sure that communities that didn't have the same access to the internet or seniors who needed help navigating the internet could actually have somewhere that they call to get assistance making appointments. And so we pretty quickly put together this line with the help of the Department of Public Health and DEMIS and a host of others. And we've been staffing up, getting ready for the onslaught of calls, and they've been coming.
Now, initially, you guys weren't open 8 a.m. to 8 p.m. This was something that happened because it was clear that the need was there. More people were calling, and therefore you needed more resources. What was the impetus behind trying to expand the hotline and the hours and the resources?
The demand is great. People really want to get their vaccines. They want to get back to their normal lives. Mm-hmm. And, you know, we got 28,000 calls on the first day that we opened up. And, you know, people were just really appreciative to talk to someone and wanting to get an appointment as soon as they can. And so we're just grateful that we were able to expand with the help of some fabulous staff who all stepped in from all parts of our agency to be able to meet the demand and serve as many people as possible.
March 1st coming up next week, and the eligibility, as we learned yesterday, is expanding to the 55 to 64 age group. That means even more calls are going to be coming in. How do you keep up with that demand?
You know, it's so important for us to, you know, use the data we have to project, and we're expecting the same amount of calls that we got during the first two phase increases. We're looking at bringing on 100 additional staff to meet the demand for March 1st. Wow. So we're anticipating taking 10,000 calls a day over the next week or so.
That is just unbelievable, and the need is clearly there. I also wanted to ask you about non-English speakers and those who are deaf or hard of hearing. What are the resources available to them?
Yeah, that's a great question. We want everyone to know that we have bilingual staff, but when there are languages that we don't have bilingual staff, we use a language interpretation service, and it has over 135 different languages that are spoken. So all the communities that have English as a second language, please feel free to call us. We're ready to take your calls. And for the deaf and hearing impaired community, we are ready to take Connecticut relay calls. Folks dial 711, and we're ready to serve that community in that way.
I've met some of the staff members walking around today. They are hardworking, they are dedicated. This is a difficult job. What do you say to them? Because they really deserve a pat on the back for all of their hard work.
Oh, just even more than a pat on the back. Yeah. These are folks literally who sometimes are working 12 days, if that was a thing.
It feels like 12 days.
It feels like 12 days, yes, that's true. But they're working 7 days a week, 8 to 8, 12 hours is what I meant. And, you know, it takes a special person to really dedicate the amount of time, the changes in the content and material, and then just really the presence to be able to be with people who may be upset or anxious or worried. It's a really special skill set, and we're lucky to have the best staff.
That is for sure. The pandemic brings about a gamut of emotions for everyone, that is for sure. So thank you so much to you, Tanya, as well as all of your staff for the unbelievable work that you have been doing. We keep showing you that number, 877-918-2224. It is one-stop shopping to answer all of your questions, and also if you are eligible currently for an appointment to be able to get that appointment. So please keep that number in mind and share it if you know someone who may be in need of that assistance. We're going to be back in just a few minutes with so much more. For now, Mark, I want to send it back to you.